Join me to complete this routine of cervical spondylosis exercises while we talk through some common questions on cervical spondylosis. Welcome or welcome back, I'm Tess, physiotherapist. Cervical spondylosis or degenerative changes in the cervical spine can lead to neck pain and stiffness, which can impact everyday activities like working, concentration, or even sleeping. Exercise can form part of a pain management program for cervical spondylosis. By the end of this video, you are going to know a routine of exercises for cervical spondylosis, as well as answers to some common questions on cervical spondylosis. And this video forms part of the spondylosis exercise series linked in the description. Let's get started.
Starting with chin tuck, looking straight ahead, use your fingers to guide your chin back, with the aim of tucking your chin. Repeat 8 times. Chin tucks aim to activate the deep neck flexor muscles, which are the core stabilizing muscles for the neck. Strengthening the deep neck flexor muscles aims to reduce strain on the joints, discs, and ligaments of the cervical spine, to subsequently reduce pain. Again, using your fingers as a guide, tuck your chin back. The second exercise is flexion and extension range of motion. Starting with flexion, bend your neck to look toward your toes. Then, extend your neck to look up toward the sky. Repeat 8 times. When completing range of motion exercises, move within a range of motion that is comfortable for you. The first question is, what does a diagnosis of cervical spondylosis mean for me? A diagnosis of cervical spondylosis means there are degenerative changes of the cervical spine, most commonly involving the intervertebral discs, facet joints, and ligaments. Degenerative changes of the spine occur with age, and most people will have some degenerative changes, with research showing that 80 to 90% of people have disc degeneration on MRI by the age of 50. What is important to note is that not all people with degenerative changes will develop symptoms. Typically, a diagnosis of cervical spondylosis will be given following investigation into symptoms, as people without symptoms are less likely to seek investigation. The third exercise is lateral flexion. This time, laterally flex your neck to bring your ear toward your right shoulder. Pause, then bring your ear toward your left shoulder. Repeat 8 times to each side. When completing lateral flexion, it's helpful to remember to keep your shoulders still and your eyes facing forward. The second question is, how often should I do cervical spondylosis exercises? How often to do exercises for cervical spondylosis may differ depending on individual circumstances, such as time available to do exercise, the level of pain experienced, and other exercise being completed. For instance, a person with higher pain levels may have to ease more gradually into doing exercises, starting with fewer sets and reps. As a general guide, exercises can be completed 3 to 6 times per week, doing 1 to 3 sets of 8 to 12 reps. Determining how often to do exercises can be guided by symptoms. For example, if 3 times per week of 3 sets is suitable to manage symptoms, this would be a good frequency and intensity to complete. The fourth exercise is cervical spine rotation. This time, turn your neck to look over your right shoulder. Pause and repeat to look over your left shoulder. Again, only go as far as comfortable. You should not feel sharp pain or dizziness. Question 3 is, how do I know if I have cervical spondylosis? Common symptoms of cervical spondylosis include neck pain, discomfort, and stiffness that has gradually worsened over time. Pain may be intermittent and not all the time, and be around the neck and shoulders. As cervical spondylosis is a degenerative condition, the pain is chronic, occurring over a period of time, as opposed to acute pain such as pain from a whiplash injury. Less frequent symptoms may also occur, including radiculopathy or nerve pain and myelopathy or muscle weakness. The best way to know if you have cervical spondylosis is to see your doctor or physiotherapist. It can be important to note that because cervical spondylosis is a broad term describing multiple pathologies, in some cases a more specific diagnosis may be made. The fifth exercise is reaching up. Lift your arms up toward the sky. Pause and bring your arms back down. Repeat 8 times. Question 4 is, can I do other exercises such as running or weight training if I have cervical spondylosis? Having a diagnosis of cervical spondylosis does not mean you cannot participate in other exercise such as running or weight training. When completing exercise, pain and symptoms should be considered. For example, if running exacerbates pain, try an alternative exercise that does not exacerbate pain, maybe riding a bike or walking. As pain subsides, begin to add running back into the program as pain allows. Additionally, the principle of progressive overload should be applied when completing exercise alongside a pain management program. For instance, if weight training, start with a lower weight that does not result in exacerbation of pain before slowly increasing weight as pain and symptoms subside. The sixth exercise is scapular protraction. With your arms by your side and your elbows bent, squeeze your shoulder blades together to bring your elbows behind your back. Repeat 8 times. The fifth question is, what if I have symptoms aside from neck pain and stiffness? Less frequently occurring symptoms include radiculopathy or nerve pain, or myelopathy, which is muscle weakness. Radiculopathy occurs from compression of nerve roots exiting the cervical spine, and myelopathy occurs from compression and inflammation of the spinal cord. The seventh exercise is butterflies. With your arms by your side, reach your arms up over your head. Bring your arms back down. Repeat 8 times. Additionally, symptoms that are not consistent with spondylosis and require additional evaluation by a medical professional include dizziness, sensory loss, gait instability, and fever. It is important to get an accurate diagnosis so that management can be tailored to the diagnosis and specific symptoms experienced. This routine forms part of the spondylosis exercise series linked in the description. The questions in this video have come from viewer questions within the series. If you would like your question answered or have follow-up questions, please leave a comment on this video. The 8th exercise is shoulder shrugs. Raise your shoulders as high as you can and lower back down. Join the AgeFit with Tess Facebook group to get further support managing pain, building strength and gaining fitness. If you have cervical spondylosis and are unsure if you have the right exercise program put together, make sure to get your complimentary AgeFit with Tess self-assessment to identify if you are meeting 10 key components of a successful exercise program. Head to www.agefitwithtess.com to get your copy. In this video, you learned a routine of exercises for cervical spondylosis. Subscribe for the next video in the spondylosis series. To continue to manage pain, build strength and gain fitness in the meantime, watch these videos here. See you next time.